We're going to look at understanding type 1 and type 2 diabetes and why it matters for sports therapists. So let's start off by looking at what is diabetes. Now, this is a chronic condition that affects how the body regulates blood glucose levels. Now, glucose is the body's main source of energy, and insulin, a hormone made by the pancreas, helps move glucose from the bloodstream into the cells. Now, there are two types of diabetes, type 1 and type 2. So let's start by looking at type 1. Now, this is an autoimmune condition. The immune system attacks and destroys the insulin producing cells in the pancreas. Now, this is typically diagnosed in childhood or adolescence, but can occur at any age. Now, people with type 1 do not produce insulin and require lifelong insulin therapy. Management involves insulin injections or pumps, regular blood glucose monitoring, and diet and lifestyle control. And then we have type 2 diabetes. This is more common and usually linked to lifestyle and genetics. The body becomes resilient to insulin or doesn't produce enough, often diagnosed in adulthood, but increasingly seen in younger people. Now, it's managed through diet, exercise, and oral medication, and in some cases, insulin. So why must a sports therapist understand about diabetes? So the first thing is safety during exercise. So exercise affects blood sugar levels. The therapist must be aware of the risk of hypoglycemia, so low blood sugar, and recognize symptoms like shakiness, confusion, fatigue, or dizziness. This is really important during rehabilitation sessions, strength training, or pitchside care. Now, the second one is individual treatment plans. So, diabetic clients may have reduced sensation, slower healing, or circulatory issues. And this can affect soft tissue work, rehabilitation, and taping techniques. Then you have emergency preparedness. So, a sports therapist may be the first to respond if an athlete experiences a diabetic emergency. Understanding the condition ensures fast, appropriate action. Also, supporting long-term health goals. Now, exercise is a cornerstone of diabetes management, especially in type 2. The therapist plays a key role in promoting safe, consistent physical activity. Interdisciplinary communication. Now, working with a diabetic client often involves conversations with GPs, nutritionists, or a diabetic nurse. A good foundational knowledge ensures effective communication and care coordination.